Leading a startup team, whether you're delivering a sugar rush, stocking coffee, or getting a regular delivery of snacks, Office Depot has solutions that fit every startup culture, from getting those first business cards and stationery to ordering fleece pullovers with your new logo. To learn how Office Depot and the California Technology Council have partnered to bring you savings on all of these startup essentials and more, go to californiatechnology.org/member benefits. I'm Daniel Levine, and this is the Bio Report.
The latest reports on the coronavirus outbreak put the number of infections at nearly 75,000 and deaths at more than 2,100. Against the backdrop of the outbreak, we spoke to Evan Loh, chairman of the Antimicrobial Working Group and CEO of Paratek Pharmaceuticals, about the global changes that are fueling the threat of infectious disease outbreaks, the state of the antimicrobial arsenal, and what needs to be done to spur the development of new agents to combat the rise of deadly bugs. Evan, thanks for joining us.
Well, thank you, Daniel. Very excited to be here with you.
We're going to talk about the Antimicrobial Working Group, the state of the antimicrobial arsenal, and what we should make of the recent Wuhan coronavirus outbreak. Perhaps we can start there. I don't want to get into the specifics of the virus, but how does a virus like this emerge?
Well, it's one of those things where situations where I think at the end of the day, nature always humbles us, right? In terms of our state of understanding of the science. And similar to SARS and other potential outbreaks such as Ebola as well, is that I think we are still, for some of these viruses, just now trying to understand them. And once we understand them, then there's an opportunity to try to create a preventative vaccine. And I think the challenge here is not only creating a preventive vaccine, which could take years, but also to develop adjuvant or adjunctive therapeutics. You may have seen the announcement today where BARDA expanded their relationship with Regeneron to specifically look at potential antibodies to treat the coronavirus. And in addition to that, I think, Daniel, as you know, as you are an aficionado of this antibiotic space and infectious disease space, that you understand that, going back to the 1918 pandemic, where there were 50 million deaths worldwide, we know that half of those deaths occurred primarily due to secondary bacterial infections, primarily due to pneumonia. And in the absence of antibiotics, you saw the mortality rate there as well. So an important part of the treatment of pandemics is not just the prevention as it relates to antivirals, but it also involves antibacterials in order to actually deal with the secondary infections, and most commonly with viral infections like coronavirus or influenza. Typically, it's antibiotics effective against pneumonia type of infections.
There are a number of factors that are conspiring to increase the movement of infectious diseases from animals to man, and also making it easier to spread to populations throughout the globe with speed. What are some of those factors that are shaping the modern landscape of infectious disease?
Well, when you look broadly across infectious disease, I think that, in animal husbandry, as you look at the use of antibiotics for the raising of cattle, chicken, swine, etc., I think those settings are ones in which people worry about those antibiotics having similar mechanisms of action to antibiotics we use today for humans, to have cross-resistance develop. And I think when you look at the SARS outbreak, where there was a resident host in an animal called civet, and in other settings where you have these viruses that reside in animal hosts that when they are ingested by humans, sometimes they actually decide to jump from animals to humans. And in this particular case, surprising to many folks is the fact that it's gone human to human. And so far to date, the infection, the pace of infection has not seemed to extinguish yet.
How well equipped are we to respond to such outbreaks, and is enough being done to monitor or contain them?
Well, I think that China is being very aggressive currently, and we hope their efforts will be beneficial. I think because of the potential understanding today of the long incubation period with this coronavirus, the horse may have gotten out of the barn here. As you see, many cases across the globe that are happening already, and we're learning that it actually seems to be able to pass from human to human quite easily. And so when you think about preparedness, which is what you're getting at with regards to pandemics or pandemic viral infections, I think it's one of those situations where you hope that you have what you need stored somewhere, and the United States takes that approach specifically with our strategic national stockpile of antibiotics and potentially vaccines as well. I think some of them have been aimed more towards prevention from a bioterrorism perspective, but I know that the CDC has a very consistent and very large commitment to containment with regards to the treatment of potential pandemic flu with their own strategic national stockpile as well. I think that the cautionary note here is that what you may have read about with regards to some companies that have devoted some of their experimental programs forward for coronavirus, it's going to take upwards of a year to identify a potential vaccine, and then you have to be able to manufacture and distribute it. So it's not something as a prophylaxis that'll be readily available, and we're still missing the therapeutic to be there. So if you don't have it on the shelf, it can take years and years and years to develop a therapeutic. And so I think from a pandemic preparedness perspective, I do think that this is a very much of a wake-up call for all countries, not just in the United States.
And what role does diagnosis play in all this? How important is it to have proper diagnosis of these conditions?
I think you've got the therapeutic. I mean, you've got the the prevention aspect with regards to vaccines, right? Very much so. You need the diagnostics and the ability to use what's called RT-PCR, polymerase chain reaction, to identify the coronavirus. Very, very helpful. The challenge, though, with the coronavirus from a diagnostic standpoint is that I don't think that epidemiologists or ID physicians quite know yet where the shedding event actually occurs for coronavirus, whether it happens early in the infection or whether it happens late in the infection. And I think the shedding timing is really important to have effective quarantine as part of the approach. And then finally, you also need, as I said earlier, adjunctive antibiotics to be able to deal with not primarily the viral-induced pneumonitis or an inflammation of the lung, but what happens when you have that viral pneumonitis or inflammation of the lung is that you basically have compromised the normal protective layers in the lungs to keep bacteria from infecting the primary lung tissue. And that's where you do need adjunctive antibiotics on the shelf in your strategic national stockpile in order to be able to deploy that on a timely basis in order to save lives.
And you use the term shedding. Does this refer to the point at which the virus expands?
That's right. Multiplies, and then it's very much within your droplets and your ability to actually communicate that through airborne droplets. That's right.
There's no specific antiviral treatment available for the Wuhan coronavirus. You talked about some timelines, but in terms of developing a therapeutic or a vaccine, are there things that need to be done to accelerate a response?
I think, unfortunately, until you know the DNA sequence sometimes of these viruses, it's very hard to know what to go after from a vaccine perspective, right? And so the challenge is going after something you don't actually know. And when this virus pops up, unless you have very similar motifs in terms of DNA sequencing that you could actually go after, very hard to do prophylactic vaccines against things that you don't actually know what's out there. And then once you know what's out there, I think smart scientists that are much smarter than me I know that some of them are working very hard to try to identify exactly what the DNA sequencing motif is that they have to go after to induce an immune response and to get that vaccine tested in humans, to look for the immune response to their adjuvant that they would use in their vaccine, and to see whether the protection is ultimately durable or not. And once they figure that out, then they have to figure out what a large-scale manufacturing approach could be going forward, and then there has to be a distribution chain superimposed or done in parallel to that as well. So you can imagine that this is a very complex process, and it just really takes time. And unfortunately, for some of the testing to watch for antibody responses as well, or to develop these vaccines, you can't speed up time.
Perhaps we can take a step back. For listeners not familiar with the Antimicrobials Working Group, what is it and what does it do?
Thank you for asking about the Antimicrobials Working Group, or we refer to ourselves in the three-letter acronym of AWG. We are a coalition of small biotech companies that are focused on developing antibiotics or antifungals. And this coalition has been around, was initially founded by Jeff Stein, who's currently the CEO of a antifungal company called Cidara, CIDARA. And we spend our time trying to do education throughout the legislative as well as in the regulatory bodies that include HHS and CMS, to educate them on what potentially could be helpful to further buttress the longevity of the antibiotic marketplace today. And unfortunately, our work each and every year that passes becomes more and more urgent, because there are, of these companies, we've had several of them declare bankruptcy in the last 6 to 12 months, and that deters future investment from investors, and it also makes it disappointing that the technologies that these companies are working on may not ever see the light of day in terms of getting to patients who desperately need them to save their lives.
I think it must now be about 20 years that I've been reading reports warning about the rise of resistant bugs and the lack of investment in new therapies to address them. It seems as though, despite the attention this has had, the problem has not gone away. Where would you say we are with regards to the threat we face from resistant bugs, and how big a problem is that today?
Well, simply put, bugs always win. And that has been true ever since penicillin was introduced into the marketplace in the early 1940s, and the tetracyclines were introduced also in the mid-1940s as well. And this antimicrobial resistance, or AMR, challenge is something that is very much part of the landscape today. And because of the absence of new technologies coming on board, doctors and hospitals have been prioritizing what they have, which are the older antibiotics, most of them being generic, who are being afflicted each and every day by increasing resistance profiles, leading to poor outcomes many times, including death. And I think that when you look at the antibiotic marketplace today, because of the absence of successful launches and successful stories, I think investors have largely walked away from the marketplace, and today it's fragile and it's very much failing, unfortunately.
What's driving the rise of superbugs?
Well, I think when you think about it, what used to happen was that there were many different novel antibiotics introduced, and they were introduced through the large pharma companies. And they had a lot of research and development investment, and they had the ability to actually do the right type of antimicrobial surveillance work. And when resistance started showing up, doctors were able to, because of what's something called selection pressure, change the antibiotic to another class of antibiotic at a low rate when there was a low rate of resistance. The bugs never really got ahead of the resistance curve in terms of overcoming the technologies. The unfortunate part now is that because there's been such a dearth of new mechanisms introduced and new chemical entities introduced, that these bugs have had kind of unfettered growth. And when doctors continue to use the antibiotics that already have known and established mechanisms of resistance, the bugs become stronger and stronger against those antibiotics, and those antibiotics become weaker each and every day they get used. And so you need the introduction of novel new antibiotics so that these bacteria don't know how to fight them, at least initially. Over time, as I said, bugs always win. But initially what you do is that you move them away from those other antibiotics and you treat them and eradicate them. And it's an effective way to ultimately monitor and manage resistance. I do think that as another component of that, a simple approach in terms of thinking about it is the right antibiotic for the right patient at the right time. If you've identified, you mentioned diagnostics, find the right bug, you have the right antibiotic, you can eradicate that bug by killing it, and the patient actually ultimately gets cured. And that's the ultimate goal that all physicians like myself care about.
There was an exodus of large pharmaceutical companies out of antibiotic development several years ago. AWG notes that less than 5% of pharmaceutical investment goes towards antimicrobial development. Why aren't more companies and larger companies working in this area?
Well, there's I think that the exodus is not just several years ago. It was actually 10 to 15 years ago that most of the large pharma companies actually have exited out of this therapeutic area. Largely, they've decided and pivoted towards oncology and rare disease assets, where the reimbursement model is much more robust for adopting technologies that are approved on day one. In the antibiotic world, the way the economic model works is that these antibiotics are, because of trying to reduce the rate of resistance, even though they may have novel mechanisms, that they are put on the shelf and, in the situation of break glass when you ultimately need it, when patients have actually failed, the older generation of antibiotics that doctors are preferentially using today. Challenge with that model is that, small companies like Paratek or others that are in the AWG, we need to solve for time, right, in order for there to be enough education, enough utilization where doctors get comfortable with the new antibiotic, that there's a reasonable utilization for the right patient at the right time, that we can actually cover our costs and ultimately become profitable so that we can actually have dollars that we can reinvest back into further research. And unfortunately, because of the investment environment, because there hasn't been a really successful recent launch in the last 5 to 6 years, and that Big Pharma is really not in play today as a near-term strategic partner, investors have really walked away and said, come back when you've actually had a successful product in terms of peak year sales. And so, unfortunately, I think we're in a situation here where the investment dollars, as AWG has said, over 90% of the investment dollars that are going into new antibiotic research is from the companies that are in the Antimicrobials working group. And the challenge there, though, is that we don't. Most of our companies just have a single product. We don't have a portfolio of multiple different products that are also commercially successful that could actually allow the antibiotic to have time to be successful. We just have one product, and we need the time to make that product successful. And without that, as you've seen with Achaogen and most recently Melinta, they've filed for bankruptcy protection because they just don't have the ability to manage not only the large investment in order to try to be successful, but their product revenues are not robust enough to sustain them on their own.
There have been efforts to incentivize the development of new antimicrobials. I think here of the GAIN Act. There has been some evidence that this helps stimulate the development of new antibiotics, but how effective has it been?
The GAIN Act was a bipartisan bill that was passed by Congress back in 2012, June. Massively important for providing an expedited regulatory path as well as enhanced regulatory exclusivity. And that GAIN Act underpinned why Paratek is here today, as I'm sure many of the other antibiotic companies today that are still in business. I think the challenge with the GAIN Act is that it allowed us to raise capital, move our products through the late-stage development phase, which is the most expensive phase, these large final pivotal trials. But it didn't provide a change in the regulatory or payment environment that allowed these antibiotics during the launch phase to ultimately be successful. And so I think that there is opportunity here, and we as the Antimicrobials Working Group have continued to do our best to educate legislators on Capitol Hill, as well as the leaders of CMS and HHS about the importance of considering what we believe on the near term is something that could be very important to all of us, which is an upgrade or a modernization of the DRG system, the diagnostic-related group payment systems for patients admitted with life-threatening infections. And the modernization that could happen is that those payments in the payment collective that includes antibiotics as well as hoteling fees and lab fees and x-ray fees have not really been modernized in the last 30 to 40 years. And what we believe would be extremely helpful would be to create a separate payment system for antibiotics outside of the DRG, where hospitals today are basically choosing antibiotics that are best for their hospital finance needs, which generally tend to be the cheapest older generics, and for them to actually then take costs out of it and to be able to pick the right antibiotic for the right patient at the right time. And, we think that would be a very important, I think, boost to the overall collective environment for antibiotics who have made it to that phase of post-approval into the early commercialization period.
What more needs to be done? Are there issues that are top of mind for AWG in terms of advocacy work?
I think advocacy work is massively important. I think one of the challenges that you may have caught wind of, Daniel, is that antimicrobials or that compose antibiotics or antifungals, we don't have a natural advocacy group. It's not as if we have, Friends of Cancer Research or, Breast Cancer Society or Cystic Fibrosis Foundation, to name a few, because we don't have the annuity of chronic illness. It's generally these infections are relatively short-lived. You either get better or you have complications and you actually may ultimately die with these life-threatening infections. And so people forget, and they're not part of any long-term advocacy group. So I do think more of these kind of conversations that I'm having with you and others to get into the lay press, I think are important to continue to talk about the importance of paying attention to this space so that antibiotic innovation doesn't go the way of the dinosaurs. And so I think advocacy is really, really important. And besides the legislative work, there's a bill called the Disarm Act that's on Capitol Hill today. There are basically mirror image bills, one sitting in the House and one sitting in the Senate. They both have bipartisan support to move forward, and we hope that this year that Congress will see the importance of this. I know that at least one of the current Democratic candidates has noted the importance of the antibiotic space as it relates to what she would want to support if she were to be elected. And so I think that our message is getting out there. We just need to continue to have advocates in Congress that will, from a legislative perspective, push this Disarm Act through, which is focused on creating this separate payment system for antibiotics outside of the DRG system. On top of that, though, we've been partnering very closely not only by ourselves, but also with the Infectious Disease Society of America, Pew, as well as Bio, as well as Merck, to actually be speaking on an educational basis with the leaders of CMS to think about whether there could be a DRG carve-out regulatory pathway under their authority that they could consider for what's called the IPPS draft rule that should be promulgated sometime in April. That's the Inpatient Prospective Payment System. And we have seen the continued advocacy by Administrator Verma in terms of the importance of considering these type of regulatory changes, and we hope that her group will be able to put something forward that can really change the dynamics in the marketplace. It has to happen now. It has to happen almost yesterday to help some of the companies that are in this particular sector to continue to survive. The other thing that needs to happen, I think that private-public partnerships with the government are going to be important to think about. It's referred to as what are called pull incentives to help through the early years of a commercial launch. You may or may not have noticed that Paratek was awarded a contract with BARDA through Project BioShield, which was BioShield was put in place by George W. Bush, and it was specifically dollars that were allocated and protected specifically to develop agents to protect Americans against bioterrorism pathogens. And our lead product has in vivo and in vitro efficacy against pulmonary anthrax, and we've been awarded a contract to develop our product against pulmonary anthrax. And this private-public partnership has also provided dollars that will add Uzira, which is our lead product, to their strategic national stockpile over the next 5 years, as well as to help us bring manufacturing onshore to the United States so that we can actually manufacture it completely in the U.S. And so BARDA then does not have to cross borders in order to be able to bring this or have this product available in the case of a bioterrorism attack. And this is very similar to what we talked about earlier in terms of pandemic preparedness.
Evan Loh, Chairman of the Antimicrobial Working Group and CEO of Paratek Pharmaceuticals. Evan, thanks so much for your time today.
Thank you, Daniel. It's been a real pleasure.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.